81. A patient with depression is prescribed a monoamine oxidase inhibitor, MALI. What should the nurse teach the patient about food restrictions? A. Avoid foods rich in carbohydrates. B. Avoid tyramine-rich foods like aged cheese and cured meats. C. Avoid salty foods and snacks. D. Avoid foods high in vitamin C. Answer. B. Avoid tyramine-rich foods like aged cheese and cured meats. Rationale. MALIs inhibit the enzyme that breaks down tyramine, which can lead to hypertensive crises if consumed in large amounts. Aged cheeses, cured meats, and fermented products are high in tyramine and should be avoided. 82. A patient with depression is being started on an SSRI. Which of the following should the nurse monitor for during the first few weeks of treatment? A. Excessive sedation. B. Decreased appetite. C. Suicidal thoughts or behaviors. D. Increased energy. Answer. C. Suicidal thoughts or behaviors. Rationale. The nurse should closely monitor for suicidal thoughts or behaviors, especially in the first few weeks of SSRI treatment, as there is an increased risk of suicidality during this period. Excessive sedation and decreased appetite are not common initial concerns. 83. Which of the following is the most common cause of treatment-resistant depression? A. Inadequate medication dosage. B. Incorrect diagnosis. C. Comorbid medical conditions. D. Lack of psychotherapy. Answer. B. Incorrect diagnosis. Rationale. One of the most common causes of treatment-resistant depression is an incorrect or incomplete diagnosis. If the underlying condition is misdiagnosed, e.g., bipolar disorder or medical conditions mimicking depression, the prescribed treatment may not be effective. 84. A patient with depression is showing signs of extreme fatigue and difficulty getting out of bed. Which intervention is most appropriate? A. Encourage the patient to get out of bed and exercise immediately. B. Allow the patient to stay in bed and rest until they feel ready. C. Set small, achievable goals, such as getting out of bed and sitting for a few minutes. D. Suggest the patient take a nap for a few hours. Answer. C. Set small, achievable goals, such as getting out of bed and sitting for a few minutes. Rationale. Gradually increasing activity and setting small, manageable goals can help patients with depression overcome fatigue and build motivation. Simply allowing rest or overwhelming the patient with tasks can prolong the depressive episode. 85. Which of the following is a risk factor for depression in older adults? A. Being married. B. Having a strong social support network. C. Chronic illness and disability. D. Being physically active. Answer. C. Chronic illness and disability. Rationale. Chronic illness and disability are major risk factors for depression in older adults. Lack of social support, physical inactivity, and social isolation also contribute to the risk, while being married and physically active can help protect against depression. 86. Which of the following is true about the relationship between depression and chronic illness? A. Depression is unrelated to chronic illness. B. Chronic illness worsens depression and can increase healthcare costs. C. Chronic illness improves depression symptoms. D. Depression causes chronic illness. Answer. B. Chronic illness worsens depression and can increase healthcare costs. Rationale. Chronic illness can exacerbate depression symptoms, leading to a higher burden of illness and increased healthcare costs. Conversely, depression does not directly cause chronic illness, but it can worsen the management of existing conditions. 87. A nurse is educating a patient about depression and treatment options. Which statement by the patient indicates a need for further teaching? A. I understand that antidepressants may take a few weeks to work. B. Once I feel better, I can stop taking my medication. C. I should follow up regularly with my healthcare provider. D. Exercise and therapy can help improve my mood. Answer. B. Once I feel better, I can stop taking my medication. Rationale. Antidepressants typically require continued use even after symptoms improve to prevent relapse. Discontinuing medication too early can lead to recurrence of symptoms. The other statements reflect correct understanding of depression and its treatment. 88. Which of the following is a potential long-term effect of untreated depression? A. Improved immune function. B. Chronic pain and fatigue. C. Enhanced cognitive function. D. Increased physical activity. Answer: B. Chronic pain and fatigue. Rationale: untreated depression can lead to chronic pain, fatigue, and other physical symptoms, as depression is often associated with somatic complaints. It does not improve immune function or cognitive function in the long term. 89. What is the main benefit of using psychotherapy, such as CBT, alongside medication for depression? A. Medication alone is sufficient to treat depression. B. Psychotherapy helps address underlying thought patterns that contribute to depression. C. Psychotherapy reduces the risk of developing side effects from medication. D. Psychotherapy can replace the need for medication. Answer: B. Psychotherapy helps address underlying thought patterns that contribute to depression. Rationale: psychotherapy, particularly cognitive behavioral therapy, helps individuals identify and challenge negative thought patterns, which can reduce the risk of relapse. It complements medication, but it does not replace it. 90. A patient with bipolar disorder reports feeling invincible and having trouble sleeping. Which phase of bipolar disorder is this patient most likely experiencing? A. Depressive phase. B. Hypomanic phase. C. Manic phase. D. Mixed phase. Answer: C. Manic phase. Rationale: the patient's feelings of invincibility and trouble sleeping are indicative of a manic episode, which is characterized by elevated mood, decreased need for sleep, and impulsive behaviors. Hypomanic phases have similar symptoms but are less severe. The depressive phase involves low mood and energy. 91. Which of the following is considered the gold standard for diagnosing major depressive disorder, MDD? A. MRI of the brain. B. Patient self-report and clinical interview. C. Blood test for serotonin levels. D. Electroencephalogram, EEG. Answer: B. Patient self-report and clinical interview. Rationale: the gold standard for diagnosing major depressive disorder is a comprehensive clinical evaluation, which includes a detailed patient self-report and clinical interview. Blood tests or imaging are not used for diagnosing MDD, although they may rule out other conditions. 92. Which neurotransmitter is most commonly associated with depression? A. Acetylcholine. B. Dopamine. C. Glutamate. D. Serotonin. Answer: D. Serotonin. Rationale: serotonin is the neurotransmitter most commonly associated with depression. Imbalances in serotonin levels are believed to contribute to depressive symptoms. While dopamine and glutamate may also play a role, serotonin is most commonly targeted in antidepressant therapy. 93. Which of the following treatments is commonly used for patients with severe, treatment-resistant depression? A. Electroconvulsive therapy, ECT. B. Cognitive behavioral therapy, CBT. C. Exercise. D. Deep brain stimulation, DBS. Answer: A. Electroconvulsive therapy, ECT. Rationale: ECT is often used for patients with severe, treatment-resistant depression. It is typically considered when other treatments, including medication and therapy, have failed. While CBT and exercise can be effective, ECT is specifically used for severe cases. 94. What is a key feature of the depressive episode in bipolar disorder? A. Increased energy and hyperactivity. B. Feelings of hopelessness and worthlessness. C. Impulsivity and risk-taking behaviors. D. Grandiosity and inflated self-esteem. Answer: B. Feelings of hopelessness and worthlessness. Rationale: in bipolar disorder, the depressive episode shares many of the features of major depressive disorder, including feelings of hopelessness and worthlessness. Increased energy and hyperactivity are associated with the manic phase, not depression. 95. Which of the following is a contraindication for the use of monoamine oxidase inhibitors, MAOIs? A. Use of acetaminophen. B. Consumption of foods high in tyramine. C. Recent use of selective serotonin reuptake inhibitors, SSRIs. D. Use of benzodiazepines. Answer: B. Consumption of foods high in tyramine. Rationale: MAOIs can cause a hypertensive crisis when taken with foods high in tyramine, e.g., aged cheese, fermented foods, which is a contraindication for their use. Acetaminophen, SSRIs, and benzodiazepines do not have the same risk with MAOIs. 96. Which of the following is a hallmark of psychotic depression? A. Hyperactivity and impulsiveness. B. Hallucinations or delusions. C. Excessive talkativeness. D. Mania or hypomania. Answer: B. Hallucinations or delusions. Rationale: psychotic depression involves the presence of psychotic features such as hallucinations or delusions, in addition to depressive symptoms. Hyperactivity and excessive talkativeness are more associated with mania. 97. Which of the following is a key risk factor for suicide in patients with depression? A. High socioeconomic status. B. Supportive family and friends. C. Previous suicide attempt. D. Good response to antidepressant medication. Answer: C. Previous suicide attempt. Rationale: a history of a previous suicide attempt is a key risk factor for suicide in patients with depression. Other risk factors include social isolation, substance abuse, and severe depression. A good response to treatment usually decreases the risk of suicide. 98. What is the mechanism of action of selective serotonin reuptake inhibitors, SSRIs? A. They inhibit the reuptake of serotonin, increasing serotonin availability. B. They increase the production of serotonin in the brain. C. They block the breakdown of serotonin in the brain. D. They inhibit the reuptake of dopamine. Answer: A. They inhibit the reuptake of serotonin, increasing serotonin availability. Rationale: SSRIs work by inhibiting the reuptake of serotonin in the brain, which increases its availability in the synaptic cleft, helping to alleviate depressive symptoms. They do not increase serotonin production or block its breakdown. 99. Which of the following is a typical side effect of tricyclic antidepressants, TCAs? A. Insomnia. B. Dry mouth. C. Weight loss. D. Increased energy. Answer: B. Dry mouth. Rationale: a common side effect of tricyclic antidepressants is dry mouth due to their anticholinergic effects. Insomnia, weight loss, and increased energy are less common with TCAs. 100. Which of the following is most commonly associated with postpartum depression? A. Feelings of invincibility. B. Hallucinations. C. Severe fatigue and feelings of worthlessness. D. Mania or hypomania. Answer: C. Severe fatigue and feelings of worthlessness. Rationale: postpartum depression often presents with symptoms such as severe fatigue, feelings of worthlessness, and irritability. Hallucinations and mania are not typical of postpartum depression, which is similar to major depressive disorder. 101. Which of the following is true regarding the use of antidepressants in children and adolescents? A. Antidepressants are not recommended for children and adolescents. B. Antidepressants have a higher risk of causing suicidal thoughts in this age group. C. Antidepressants are always safe and effective for children and adolescents. D. Antidepressants should only be prescribed after failure of psychotherapy. Answer: B. Antidepressants have a higher risk of causing suicidal thoughts in this age group. Rationale: antidepressants, especially SSRIs, have been shown to increase the risk of suicidal thoughts and behaviors in children and adolescents. Close monitoring is essential when prescribing these medications to this age group. 102. What is the primary benefit of using cognitive behavioral therapy, CBT, for depression? A. It focuses on increasing serotonin levels in the brain. B. It helps individuals identify and change negative thought patterns. C. It requires no active participation from the patient. D. It is only effective for treating severe depression. Answer: B. It helps individuals identify and change negative thought patterns. Rationale: CBT helps individuals recognize and challenge negative thought patterns and behaviors, which can help reduce depressive symptoms. It does not directly affect serotonin levels, but rather focuses on improving coping mechanisms. 103. Which of the following is a primary characteristic of dysthymia, persistent depressive disorder? A. Episodes of mania alternating with depression. B. Depressed mood lasting for at least 2 years. C. Symptoms of depression that last for more than 6 months. D. Extreme mood swings. Answer: B. Depressed mood lasting for at least 2 years. Rationale: dysthymia, or persistent depressive disorder, is characterized by a chronically depressed mood lasting for at least 2 years, though the symptoms may be less severe than those of major depressive disorder. 104. Which of the following is a common treatment for depression in pregnant women? A. Electroconvulsive therapy, ECT. B. Monoamine oxidase inhibitors, MALIs. C. Cognitive behavioral therapy, CBT. D. Lithium. Answer: C. Cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, is often recommended for pregnant women with depression because it is a non-pharmacological treatment with fewer risks compared to medications. ECT may be considered in severe cases, but is not the first-line treatment. 105. Which of the following factors is most likely to increase the risk of depression in older adults? A. High level of physical activity. B. Strong social support network. C. Chronic medical conditions such as diabetes or heart disease. D. Regular mental stimulation and cognitive activity. Answer: C. Chronic medical conditions such as diabetes or heart disease. Rationale: chronic medical conditions such as diabetes or heart disease increase the risk of depression in older adults due to the burden of managing physical health problems. Social support and mental stimulation typically protect against depression. 106. Which of the following is a warning sign that a patient with depression may be at risk for suicide? A. Increased social interaction and engagement. B. Giving away personal belongings. C. Improved mood and energy levels. D. Decreased use of alcohol or drugs. Answer: B. Giving away personal belongings. Rationale: giving away personal belongings can be a warning sign that a person with depression may be contemplating suicide, as it can signal preparation for death. An improvement in mood or energy levels does not necessarily mean the risk of suicide is decreased. 107. What is the first-line pharmacological treatment for depression in adults? Aimed tricyclic antidepressants, TCAs. B. Selective serotonin reuptake inhibitors, SSRIs. C. Monoamine oxidase inhibitors, MALIs. D. Atypical antipsychotics. Answer: B. Selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are generally considered first-line treatment for depression in adults due to their effectiveness and relatively favorable side effect profile. TCAs and MALIs are used less frequently due to their side effect profiles and potential toxicity. 108. Which of the following is a potential side effect of selective serotonin reuptake inhibitors, SSRIs? A. Insomnia and anxiety. B. Increased appetite and weight gain. C. Sedation and lethargy. D. Hypertension and tachycardia. Answer: A. Insomnia and anxiety. Rationale: SSRIs can cause insomnia and increased anxiety, especially in the early stages of treatment. Weight gain, sedation, and hypertension are not typically associated with SSRIs. 109. A nurse is caring for a patient with depression who is refusing to eat. What should the nurse do first? A. Force the patient to eat. B. Provide a quiet environment and allow the patient to rest. C. Encourage the patient to eat small, frequent meals. D. Notify the healthcare provider immediately. Answer: C. Encourage the patient to eat small, frequent meals. Rationale: encouraging small, frequent meals can help manage poor appetite, a common symptom of depression. Forcing the patient to eat or simply waiting without intervention are not effective strategies. Notifying the provider may be necessary if the patient's refusal to eat persists. 110. Which of the following lifestyle changes is most likely to help improve symptoms of depression? A. Decreasing physical activity and rest. B. Regular exercise and healthy eating. C. Isolation and limiting social interaction. D. Avoiding all stressful situations. Answer: B. Regular exercise and healthy eating. Rationale: regular exercise and healthy eating can improve mood and overall well-being, helping to reduce symptoms of depression. Physical inactivity and isolation typically worsen depression. Avoiding stress is not always practical or possible, and some stress is necessary for growth. 111. Which of the following is a common symptom of depression in children? A. Hyperactivity and impulsivity. B. Lack of interest in previously enjoyed activities. C. Increased energy levels. D. Elevated mood and grandiosity. Answer: B. Lack of interest in previously enjoyed activities. Rationale: children with depression often experience anhedonia, which is the inability to enjoy activities they once found pleasurable. Hyperactivity and impulsivity are more associated with attention deficit hyperactivity disorder, ADHD. 112. A nurse is discussing the risks of long-term use of antidepressants. Which of the following is a potential risk of long-term use of selective serotonin reuptake inhibitors, SSRIs? A. Weight loss. B. Sexual dysfunction. C. Increased risk of Parkinson's disease. D. Chronic insomnia. Answer: B. Sexual dysfunction. Rationale: sexual dysfunction, including reduced libido and difficulty achieving orgasm, is a known side effect of SSRIs. Weight gain is more common than weight loss, and SSRIs do not increase the risk of Parkinson's disease or chronic insomnia. 113. Which of the following therapies is most commonly used to treat patients with seasonal affective disorder, SAD? A. Electroconvulsive therapy, ECT. B. Bright light therapy. C. Interpersonal therapy, IPT. D. Transcranial magnetic stimulation, TMS. Answer: B. Bright light therapy. Rationale: bright light therapy is commonly used to treat seasonal affective disorder, SAD, which is a type of depression linked to changes in seasons. ECT and TMS are used for more severe forms of depression, and IPT is a type of psychotherapy used for various types of depression, but not specifically for SAD. 114. Which of the following is a common side effect of lithium, a medication used to treat bipolar disorder? A. Increased energy and restlessness. B. Weight loss and insomnia. C. Tremors and frequent urination. D. Sedation and lethargy. Answer: C. Tremors and frequent urination. Rationale: lithium, a mood stabilizer used to treat bipolar disorder, can cause side effects like tremors and frequent urination. Weight gain, sedation, and restlessness are not typical side effects of lithium. 115. A patient diagnosed with major depressive disorder is prescribed an SSRI. Which of the following instructions is most important for the nurse to include when teaching the patient about this medication? A. It may take several weeks before you feel the full effects of the medication. B. You may need to take this medication for the rest of your life. C. You should take this medication only when you feel depressed. D. This medication will immediately improve your mood. Answer: A. It may take several weeks before you feel the full effects of the medication. Rationale: SSRIs typically take several weeks to show their full effects. Patients should not expect immediate mood improvement, and medication should be taken consistently, even when symptoms improve. The duration of therapy varies based on the patient's response. 116. Which of the following is a possible complication of untreated depression? A. Increased social interaction. B. Chronic physical illness. C. Enhanced memory and cognitive function. D. Increased appetite and weight gain. Answer: B. Chronic physical illness. Rationale: untreated depression can lead to chronic physical conditions such as cardiovascular disease and immune system dysfunction. It does not improve memory or cognitive function, and while depression can lead to changes in appetite, it typically causes weight loss rather than weight gain. 117. A nurse is educating a patient with depression about the potential side effects of their prescribed medication. Which of the following side effects should the nurse emphasize as being most common with selective serotonin reuptake inhibitors, SSRIs? A. Weight gain and sedation. B. Increased risk of suicidal thoughts. C. Extreme fatigue and lethargy. D. Photosensitivity and skin rashes. Answer: B. Increased risk of suicidal thoughts. Rationale: SSRIs are associated with an increased risk of suicidal thoughts, especially in children, adolescents, and young adults. Weight gain, sedation, and photosensitivity are not as common with SSRIs. 118. Which of the following is a significant risk factor for depression in older adults? A. Strong family support. B. Chronic illness and disability. C. High socioeconomic status. D. Healthy diet and exercise routine. Answer: B's. Chronic illness and disability. Rationale: chronic illness and disability are significant risk factors for depression in older adults due to the physical and emotional strain they place on the individual. A healthy lifestyle, family support, and high socioeconomic status typically protect against depression. 119. What is the main purpose of cognitive behavioral therapy, CBT, in the treatment of depression? A. To provide immediate relief from depressive symptoms. B. To help the patient identify and change negative thought patterns. C. To encourage the patient to rely on medication for symptom management. D. To use relaxation techniques to reduce stress. Answer: B. To help the patient identify and change negative thought patterns. Rationale: the primary goal of cognitive behavioral therapy, CBT, is to help patients identify and modify negative thought patterns that contribute to their depressive symptoms. CBT does not provide immediate symptom relief, but aims to improve long-term mental health by changing thought patterns. 120. Which of the following best describes the use of transcranial magnetic stimulation, TMS, in depression treatment? A. It involves surgically implanting electrodes in the brain. B. It uses magnetic fields to stimulate specific areas of the brain. C. It uses electrical shocks to the brain to induce seizures. D. It involves the administration of intravenous medications. Answer: B. It uses magnetic fields to stimulate specific areas of the brain. Rationale: transcranial magnetic stimulation, TMS, uses magnetic fields to stimulate specific areas of the brain, particularly those involved in mood regulation. It is a non-invasive procedure used for treatment-resistant depression. 121. A nurse is caring for a patient recently diagnosed with major depressive disorder. The patient expresses feelings of hopelessness and helplessness. Which of the following is the most appropriate nursing intervention? A. Encourage the patient to engage in physical activities. B. Reassure the patient that everything will get better soon. C. Help the patient identify and verbalize their feelings. D. Recommend immediate discharge to a psychiatric facility. Answer: C. Help the patient identify and verbalize their feelings. Rationale: helping the patient identify and express their feelings in a supportive environment can be therapeutic and assist in processing emotions. Reassurance without understanding the patient's feelings is not helpful. Physical activity may be encouraged later in treatment. 122. Which of the following medications is typically prescribed to patients with depression who also have insomnia? A. Zolpidem. B. Trazodone. C. Mirtazapine. D. Bupropion. Answer: B. Trazodone. Rationale: trazodone is commonly prescribed for patients with depression and insomnia due to its sedative effects. While zolpidem is used for sleep, it is not typically prescribed for depression. Mirtazapine and bupropion are antidepressants, but do not have the same sedative effect as trazodone. 123. Which of the following is a major characteristic of major depressive disorder, MDD? A. Elevated mood lasting for more than a week. B. Episodes of depression that resolve within 3 to 6 months. C. Persistent sadness and lack of interest or pleasure in activities. D. Symptoms that are only triggered by external stressors. Answer: C. Persistent sadness and lack of interest or pleasure in activities. Rationale: major depressive disorder, MDD, is characterized by persistent sadness and anhedonia, lack of interest or pleasure in activities. The mood disturbance lasts for at least 2 weeks and may be chronic if untreated. 124. A patient is diagnosed with bipolar disorder and is currently in the manic phase. Which of the following behaviors would most likely be observed in this phase? A. Slow speech and difficulty concentrating. B. Lack of interest in social activities. C. Excessive talking and impulsivity. D. Low energy and irritability. Answer: C. Excessive talking and impulsivity. Rationale: in the manic phase of bipolar disorder, individuals often exhibit symptoms such as excessive talking, impulsivity, and a decreased need for sleep. In contrast, depressive phases involve low energy, irritability, and reduced social interest. 125. What is the first-line treatment for a patient with major depressive disorder who has no history of treatment resistance? A. Electroconvulsive therapy, ECT. B. Selective serotonin reuptake inhibitors, SSRIs. C. Tricyclic antidepressants, TCAs. D. Antipsychotic medications. Answer: B. Selective serotonin reuptake inhibitors, SSRIs. Rationale: SSRIs are considered first-line treatment for major depressive disorder due to their efficacy and relatively mild side effect profile. ECT and TCAs are used for more severe or treatment-resistant cases. 126. Which of the following is a common physical symptom of depression? A. Increased appetite and weight gain. B. Chronic pain or gastrointestinal issues. C. Weight loss and excessive energy. D. Low blood pressure and dizziness. Answer: B. Chronic pain or gastrointestinal issues. Rationale: depression is commonly associated with chronic pain, gastrointestinal problems, and other somatic symptoms. Weight loss and excessive energy are more associated with certain medical conditions but not depression. 127. What is the role of selective serotonin reuptake inhibitors, SSRIs, in the treatment of depression? A. They improve mood by increasing serotonin levels in the brain. B. They block serotonin production in the brain. C. They provide immediate symptom relief in depressive episodes. D. They act as a sedative for patients with severe insomnia. Answer: A. They improve mood by increasing serotonin levels in the brain. Rationale: SSRIs work by inhibiting the reuptake of serotonin, leading to increased serotonin availability in the brain, which helps improve mood. They do not block serotonin production and do not act as sedatives. 128. A patient with depression is experiencing feelings of worthlessness and guilt. Which of the following therapeutic approaches is most likely to help with these feelings? A. Psychoanalysis to uncover unconscious thoughts. B. Cognitive behavioral therapy, CBT, to challenge negative thought patterns. C. Electroconvulsive therapy, ECT, to treat severe depression. D. Supportive counseling to validate emotions. Answer: C. Sexual dysfunction and insomnia. Rationale: SSRIs like fluoxetine can cause sexual dysfunction, e.g., decreased libido, difficulty achieving orgasm, and insomnia. Sedation and weight gain are more commonly associated with other classes of antidepressants. 129. A nurse is caring for a patient with major depressive disorder who is prescribed fluoxetine. Which of the following adverse effects should the nurse monitor for? A. Sedation and dizziness. B. Weight gain and excessive sleep. C. Sexual dysfunction and insomnia. D. Increased appetite and hypersomnia. Answer: B. To improve neurotransmitter activity in the brain. Rationale: ECT is used to improve neurotransmitter activity in the brain, particularly in patients with severe or treatment-resistant depression. It does not address physical pain or cure depression permanently. 130. What is the primary reason for the use of electroconvulsive therapy, ECT, in patients with depression? A. To relieve physical pain associated with depression. B. To improve neurotransmitter activity in the brain. C. To induce sleep in patients with depression. D. To provide a permanent cure for depression. Answer: B. Development of chronic medical conditions. Rationale: untreated depression is associated with the development of chronic medical conditions, such as cardiovascular disease, due to the physiological and behavioral impacts of prolonged depression. 131. Which of the following is a major risk associated with untreated depression? A. Enhanced cognitive function. B. Development of chronic medical conditions. C. Improvement in mood and functioning. D. Increased social engagement. Answer: B. Psychotherapy, particularly cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, is considered the most effective long-term treatment for chronic depression or dysthymia, as it helps patients identify and challenge negative thought patterns. Physical exercise is beneficial but not a primary treatment for chronic depression. 132. Which of the following is the most effective long-term treatment for chronic depression, dysthymia? A. Electroconvulsive therapy, ECT. B. Psychotherapy, particularly cognitive behavioral therapy, CBT. C. Antipsychotic medications. D. Regular physical exercise. Answer: B. Psychotherapy, particularly cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, is considered the most effective long-term treatment for chronic depression or dysthymia as it helps patients identify and challenge negative thought patterns. Physical exercise is beneficial but not a primary treatment for chronic depression. 133. Which of the following factors increases the likelihood of depression relapse in patients who have previously experienced major depressive disorder? A. Regular social interactions. B. Recent stressful life events. C. Adequate sleep and exercise. D. Use of antidepressant medications. Answer: B. Recent stressful life events. Rationale: stressful life events can trigger a relapse of depression, especially in patients who have a history of major depressive disorder. Regular social interactions, exercise, and antidepressant use are protective factors. 134. A nurse is educating a patient with depression about non-pharmacological treatments. Which of the following should the nurse recommend to the patient as a potential treatment? A. Aromatherapy only. B. Bright light therapy for seasonal affective disorder. C. Fasting to improve mood. D. Self-isolation to reduce stress. Answer: B. Bright light therapy for seasonal affective disorder. Rationale: bright light therapy is a well-established non-pharmacological treatment for seasonal affective disorder, SAD. Aromatherapy may offer some relaxation benefits, but is not a primary treatment for depression. Fasting and self-isolation are not recommended strategies. 135. Which of the following is a common side effect of the antidepressant mirtazapine? A. Insomnia and weight loss. B. Sedation and weight gain. C. Sexual dysfunction and nausea. D. Increased energy and anxiety. Answer: B. Sedation and weight gain. Rationale: mirtazapine is an antidepressant known for its sedative effects, often leading to drowsiness, and can cause weight gain. It is often prescribed to patients with depression who have trouble sleeping or who have low appetite. 136. A patient with depression expresses feelings of guilt and worthlessness. What is the most appropriate nursing intervention? A. Validate the patient's feelings and offer reassurance. B. Encourage the patient to focus on positive aspects of life. C. Assist the patient in identifying and challenging negative thought patterns. D. Minimize the patient's feelings of guilt by changing the subject. Answer: C. Assist the patient in identifying and challenging negative thought patterns. Rationale: assisting the patient in identifying and challenging negative thoughts is a cornerstone of cognitive behavioral therapy, CBT, and helps address feelings of guilt and worthlessness. Reassurance alone is not sufficient for addressing these feelings in depression. 137. What is the first-line treatment for depression during pregnancy? A. Electroconvulsive therapy, ECT. B. Antidepressant medications, such as SSRIs. C. Cognitive behavioral therapy, CBT. D. Light therapy. Answer: C. Cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, is often considered the first-line treatment for depression during pregnancy due to its non-pharmacological nature. Antidepressant medications may be used, but they carry potential risks during pregnancy and are typically prescribed with caution. 138. Which of the following is an important consideration when prescribing selective serotonin reuptake inhibitors, SSRIs, for elderly patients? A. SSRIs are contraindicated in elderly patients. B. Elderly patients may be more susceptible to side effects, including hyponatremia. C. SSRIs have no risk of side effects in elderly patients. D. SSRIs should be given in higher doses for elderly patients. Answer: B. Elderly patients may be more susceptible to side effects, including hyponatremia. Rationale: elderly patients may be more susceptible to side effects of SSRIs, including hyponatremia, low sodium levels. Dosing should generally be lower in this population, and they should be carefully monitored for adverse effects. 139. A nurse is caring for a patient with depression who has expressed feelings of hopelessness. Which of the following interventions is most appropriate? A. Providing a detailed explanation of the patient's treatment plan. B. Encouraging the patient to engage in pleasant activities. C. Assuring the patient that their feelings will resolve soon. D. Offering solutions to the patient's problems. Answer: B. Encouraging the patient to engage in pleasant activities. Rationale: encouraging patients to engage in pleasant activities, even small ones, can help counteract feelings of hopelessness by improving mood and providing a sense of accomplishment. Offering solutions or making assumptions about how the patient feels can feel dismissive. 140. What is the mechanism of action of monoamine oxidase inhibitors, MALIs, in the treatment of depression? A. They increase the reuptake of serotonin. B. They block the breakdown of serotonin, dopamine, and norepinephrine. C. They increase the release of serotonin in the brain. D. They block dopamine receptors in the brain. Answer: B. They block the breakdown of serotonin, dopamine, and norepinephrine. Rationale: MALIs work by inhibiting the enzyme monoamine oxidase, which normally breaks down serotonin, dopamine, and norepinephrine. This leads to increased levels of these neurotransmitters in the brain, helping alleviate depressive symptoms. 141. Which of the following is a potential side effect of the antidepressant bupropion? A. Weight gain and sedation. B. Increased risk of seizures. C. Sexual dysfunction and insomnia. D. Gastrointestinal bleeding. Answer: B. Increased risk of seizures. Rationale: bupropion is associated with an increased risk of seizures, especially at higher doses. It has a more favorable side effect profile in terms of sexual dysfunction and weight changes compared to other antidepressants. 142. A nurse is caring for a patient who is on antidepressant therapy. Which of the following is most important to monitor during treatment? A. Weight and dietary intake. B. Blood pressure and heart rate. C. Liver function and kidney function. D. Suicidal thoughts and behaviors. Answer: D. Suicidal thoughts and behaviors. Rationale: suicidal thoughts and behaviors are a significant concern during antidepressant treatment, particularly in the early stages or when medications are adjusted. Close monitoring for any changes in mood or behavior is essential. 143. Which of the following should be included in the nursing care plan for a patient with depression who is exhibiting social withdrawal? A. Encourage the patient to engage in social activities immediately. B. Respect the patient's need for privacy and minimize social interactions. C. Encourage participation in group therapy or social activities as tolerated. D. Allow the patient to isolate without attempting to engage. Answer: C. Encourage participation in group therapy or social activities as tolerated. Rationale: encouraging gradual participation in social activities can help reduce isolation and improve mood. Completely isolating the patient can exacerbate depressive symptoms. 144. Which of the following is a primary focus when treating depression with cognitive behavioral therapy, CBT? A. Improving the patient's physical health. B. Identifying and challenging negative thought patterns. C. Providing pharmacological treatment. D. Focusing on unconscious thoughts and feelings. Answer: B. Identifying and challenging negative thought patterns. Rationale: the primary focus of CBT is to help patients identify and challenge negative thought patterns that contribute to their depressive symptoms. It is not focused on unconscious thoughts, physical health, or pharmacological treatments. 145. Which of the following symptoms is most commonly associated with seasonal affective disorder, SAD? A. Insomnia and hyperactivity. B. Social withdrawal and excessive sleep. C. Mania and impulsivity. D. Paranoia and delusions. Answer: B. Social withdrawal and excessive sleep. Rationale: seasonal affective disorder, SAD, often occurs during the winter months and is characterized by symptoms such as social withdrawal, excessive sleep, hypersomnia, and weight gain. 146. A nurse is assessing a patient with depression for suicide risk. Which of the following behaviors would indicate an increased risk of suicide? A. Engaging in daily social activities. B. Expressing a desire to feel better without a plan. C. Giving away personal belongings. D. Having occasional periods of mild sadness. Answer: C. Giving away personal belongings. Rationale: Giving away personal belongings is a common sign of suicidal intent. The other behaviors listed do not indicate an increased risk for suicide. 147. Which of the following statements is true regarding the use of antidepressants in children and adolescents? A. Antidepressants are not effective in treating depression in children. B. Antidepressants increase the risk of suicidal thoughts in children and adolescents. C's antidepressants are always the first-line treatment for depression in children. D. Antidepressants are not associated with any side effects in children and adolescents. Answer. B. Antidepressants increase the risk of suicidal thoughts in children and adolescents. Rationale. Studies have shown that antidepressants can increase the risk of suicidal thoughts and behaviors in children and adolescents. Close monitoring is essential in this population. 148. A nurse is educating a patient about the side effects of a tricyclic antidepressant, TCA. Which of the following should the nurse include in the education? A. Dry mouth and blurred vision. B. Weight loss and excessive energy. C. Nausea and vomiting. D. Increased appetite and drowsiness. Answer. A. Dry mouth and blurred vision. Rationale. Tricyclic antidepressants, TCAs, are known for causing anticholinergic side effects such as dry mouth, blurred vision, urinary retention, and constipation. Weight loss is not commonly associated with TCAs. 149. Which of the following behaviors is a characteristic of the manic phase of bipolar disorder? A. Low self-esteem and excessive sleep. B. Extreme optimism and impulsive behavior. C. Social withdrawal and feelings of worthlessness. D. Feelings of sadness and loss of interest in activities. Answer. B. Extreme optimism and impulsive behavior. Rationale. The manic phase of bipolar disorder is characterized by elevated mood, extreme optimism, impulsive behavior, and decreased need for sleep. The other behaviors are more characteristic of depression. 150. A nurse is assessing a patient diagnosed with depression. The patient reports feeling fatigued despite adequate sleep. Which of the following is the most likely cause of this symptom? A. Hypothyroidism. B. Increased physical activity. C. Depression-related changes in neurotransmitters. D. Excessive caffeine intake. Answer. C. Depression-related changes in neurotransmitters. Rationale. Fatigue despite adequate sleep is a common symptom of depression due to changes in neurotransmitter activity. Hypothyroidism can also cause fatigue, but is not as specific to depression. 151. Which of the following antidepressants is most likely to cause sexual dysfunction? A. Bupropion. B. Mirtazapine. C. Fluoxetine. D. Trazodone. Answer. C. Fluoxetine. Rationale. Selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, are commonly associated with sexual dysfunction, including decreased libido and difficulty achieving orgasm. Bupropion and mirtazapine have a lower risk of sexual side effects. 152. A patient with major depressive disorder is prescribed an SSRI. The patient reports feeling better after 2 weeks of therapy. Which of the following is the nurse's most important next step? A. Reassure the patient that the medication is working. B. Monitor for any potential adverse effects. C. Increase the dose of the medication. D. Discontinue the medication to avoid dependency. Answer. B. Monitor for any potential adverse effects. Rationale. Although the patient is feeling better, SSRIs can take 4 to 6 weeks to show full effects. The nurse should monitor for side effects and suicidal thoughts, especially in the early stages of treatment. 153. A patient diagnosed with depression is prescribed sertraline. Which of the following is most important for the nurse to include in the patient's teaching plan? A. You should take this medication with food to reduce gastrointestinal upset. B. You may experience a sudden burst of energy and should avoid any activity until your energy levels stabilize. C. It may take several weeks to feel the full effects of the medication. D. This medication may cause an increase in appetite and weight gain. Answer. C. It may take several weeks to feel the full effects of the medication. Rationale. SSRIs, such as sertraline, can take several weeks to show their full effect. The other statements are not accurate regarding SSRIs, as they typically do not cause significant weight gain and do not cause immediate bursts of energy. 154. A nurse is teaching a patient about cognitive behavioral therapy, CBT, for depression. Which of the following statements is most accurate? A. CBT focuses on helping you uncover unconscious thoughts from your past. B. CBT will help you change negative thought patterns that contribute to your depression. C. CBT requires you to take antidepressant medication along with therapy. D. CBT only focuses on changing your behavior, not your thoughts. Answer. B. CBT will help you change negative thought patterns that contribute to your depression. Rationale. Cognitive behavioral therapy, CBT, focuses on identifying and changing negative thought patterns to improve mood and behavior. It does not focus on unconscious thoughts from the past or only on behavior changes. 155. A patient with depression is prescribed a serotonin-norepinephrine reuptake inhibitor, SNRI. Which of the following is a common side effect of SNRIs? A. Nausea and dizziness. B. Sedation and weight gain. C. Increased energy and insomnia. D. Sexual dysfunction and irritability. Answer. A. Nausea and dizziness. Rationale. SNRIs can cause side effects like nausea, dizziness, and headaches. They are less likely to cause sedation or weight gain compared to other antidepressants. 156. Which of the following is a priority intervention for a patient who is expressing suicidal ideation? A. Encourage the patient to focus on positive thoughts. B. Ensure the patient is in a safe and supportive environment. C. Ask the patient to leave their belongings behind. D. Recommend the patient engage in physical activity. Answer. B. Ensure the patient is in a safe and supportive environment. Rationale. Ensuring the patient's safety is the first priority when they are expressing suicidal ideation. Offering support and creating a safe environment is critical before addressing other concerns. 157. A nurse is providing discharge teaching to a patient with depression. Which of the following should the nurse emphasize to the patient? A. You should continue your medication even after you feel better. B. You can stop your medication once you start feeling better. C. Your symptoms should completely resolve within 2 to 3 weeks. D. You can take your medication as needed. Answer. A. You should continue your medication even after you feel better. Rationale. It is important to continue antidepressant medications as prescribed, even if the patient feels better, to prevent relapse. Stopping the medication too early can lead to a recurrence of symptoms. 158. Which of the following is a common complication associated with untreated depression? A. Improved cognitive function. B. Increased risk of chronic illness. C. Improved social interactions. D. Increased energy levels. Answer. B. Increased risk of chronic illness. Rationale. Untreated depression can lead to an increased risk of chronic illnesses such as heart disease, diabetes, and autoimmune disorders due to the physiological effects of depression. 159. A patient with depression is being treated with electroconvulsive therapy, ECT. Which of the following is a common side effect of ECT? A. Memory loss. B. Weight gain. C. Increased libido. D. Hypertension. Answer. A. Memory loss. Rationale. Memory loss is a common side effect of electroconvulsive therapy, ECT, especially short-term memory loss. The other listed effects are not typical side effects of ECT. 160. Which of the following is a characteristic feature of persistent depressive disorder, dysthymia? A. Severe mood swings and episodes of mania. B. Depressed mood lasting for at least 2 years. C. Episodes of depression that last no longer than 2 weeks. D. No history of depression symptoms. Answer. B. Depressed mood lasting for at least 2 years. Rationale. Persistent depressive disorder, dysthymia, is characterized by a chronically low mood lasting for at least 2 years. It is less severe than major depressive disorder, but is longer lasting.